I'm going to hand over now to my colleague John Parkinson, who was my predecessor at the New South Wales Neuro-Oncology Group as the chair, who's going to be taking over for the launch component of today's events.
Thanks, Liz, and thanks for running the panel in. That was excellent. So my next task for today is something that I undertook as the chair of the New South Wales Neuro-Oncology Group, and something I feel very privileged to have been involved with as I was as I think this is we've developed some fantastic resources for patients, and hopefully something that we'll see used quite widely. Essentially, Brain Tumour Alliance Australia, or BTAA, were successful in obtaining a project grant from Cancer Australia in 2016. And essentially, this came about through looking at resources available for people with different language backgrounds, so English as a second language backgrounds, such that we were able to develop some resources for brain tumour patients that were are now available in 10 other languages. So the way it sort of evolved, and I was on the steering committee of this, was that we saw the opportunity to develop resources that actually would be useful for you know, in English as well as the second languages. So as much as we've, I really feel like this is a really good utilisation of the funds and the opportunity, because we've created resources that I think will be very widely applicable to brain tumour patients. So what we've basically done is come up with some resources, and I'll try and just project these up on the screen, that really do help to sort of navigate the brain tumour journey, if you will. So first of all, let me just make sure this pops up there. Lots of what we found, and a lot of the feedback we received, and the resolution's not perfect on that, so I apologise about that, but what we found is a lot of patients got a lot of information about their tumour and about their treating team, and didn't have a kind of a neat way to bring it all together. So the first thing we did was come up with this resource, which is basically a single page that talks about, you know, just as a place in which to hold all the information, that a type of tumour, what that means in terms of the grade, some of the other important tumour features that may, you know, such as the things with some of the molecular testing we've been talking about this morning, some of the treatments and side effects, even just on this little picture here, just drawing where the tumour is, you know, what the frontal lobe means or the temporal lobe means. And then obviously what sort of treatment a patient has had or will be having if they're involved in a trial, seizure management and other medications. At the bottom, we've put just a few sources of help, you know, so resources, support resources and information resources. And then on this side, we obviously have the ability just to write down, you know, who the members of the treating teams are. So, you know, who the neurosurgeon is and an oncologist, etc. Because often you see different people when you're in the hospital, you know, registrars and fellows and all of that sort of thing, as well as seeing but knowing, you know, A, who the person is who's kind of in charge, and B, how to get hold of them, we thought was really useful. The second thing, second part of that resource was to look at the sort of pathway that, I guess, again, the journey that most brain tumour patients go through. So looking at, you know, where the diagnosis is, just commenting on how there's a review of each individual, but often that happens behind the scenes. I think lots of people don't realise how often we talk to each other. Ongoing scans, treatments, and then how things might go if there is, you know, some change. That means that, you know, what options are there when we look, you know, when tumours do progress or occur. And then beyond that, the other sort of supportive care side of things, so focusing on, I guess, the clinical care and the supportive care, so what practical support there is, what support there is for carers, rehab, self-care and wellness and all those sort of things. And these resources have been developed, and we developed them in English, and then they've been translated into 10 additional languages. And I'll show you the list of languages in a moment. So I think this in itself is just fantastic. You know, for someone like me, who's often the first person to speak to someone about a brain tumour diagnosis, to be able to sort of have a piece of paper and sit down and go, look, this is where we're at. This is who I am. This is what I do. This is the team. You know, this is what this test. These are the few tests that people are going to ask you these questions. I think is a really, really valuable thing. The next resource that we developed or redeveloped is a better way to say it, and then had translated, was a book that was written by I'm just trying to think of what her title is. Danette Langbecker, who's a researcher in the area of supportive care in Queensland. She'd written this book. It's been available. It was revised and updated because, as we've seen this morning, you know, treatment and pathways have been revised all the time. So this is a booklet of, I'm not sure how many pages is it, roughly 34. Okay, that's been with a whole bunch of, you know, as we sort of said leading into the panel, everyone has questions. Questions are, you know, there's no such thing as silly questions, and you know, the main reason is to show people that it is okay to ask questions, and as doctors and clinicians, we're expecting you to ask questions, and you know, often the questions that you have are questions that everyone has, and when they're not, and everyone's there to work, you know, for you. So, and again, so this has been revised and also then translated into the 10 languages. And it doesn't really project very well. Sorry about that. But there are also some videos that have been placed online. There's some more information about that outside. But basically, the documents and the videos are in these 10 languages here: Arabic, Chinese, Dari, Filipino, Greek, Hindi, Italian, Vietnamese, Punjabi, and Spanish. So we feel that, you know, that this has really provided us a very good opportunity to be able to help, you know, improve the brain tumour journey for a vast number of patients in Australia. And, you know, personally, I'm very grateful for having the opportunity to be involved with this, and I think everyone has. So if you want any more information about these resources, then you know, the BTAA stand outside has some examples, and you know, I'd be more than happy to take any questions, as would Tricia and Catherine and everyone from BTAA. So next, I'd like to get the Cancer Australia perspective on this from Dr. Helen Zorbas. So if you can come up to the stage, that would be great. Thank you.
Thank you, Jonathan, and it's a real pleasure to be able to be here in person with you all this afternoon. It is afternoon now, isn't it? I'd like to just begin by acknowledging the traditional owners of the land on which we meet today, the Gadigal people of the Eora Nation, and pay my respects to their elders past, present and emerging, and to acknowledge any Aboriginal or Torres Strait Islander people who may be here today. So I was really very engaged in the session. I'm glad I was able to come here a bit earlier and hear that Q&A, and particularly so as I was actually, I still am, I think, on the Minister's Steering Group on medicinal cannabis. So I do encourage you to have a look at the TGA website, which will have which does have the analysis of the very detailed evidence review that was undertaken, where there was evidence, and gives an analysis of where there might be some benefit or not at this point in time for different uses of medicinal cannabis. I'm also delighted to sort of add in terms of context to let you know, I'm sure you do know, that the Medical Research Future Fund, which is a huge investment across governments, we hope, of any colour, have established an Australian brain cancer mission, which was the first mission as part of the Medical Research Future Fund investment, and Cancer Australia is overseeing that investment. It's currently at $124.7 million, and that's bringing together federal government money with philanthropy and other governments' money, other research organisations. It brings clinicians and patients around the table. There is a research strategy to inform that investment over time. So again, if you're interested in knowing a bit more about that, this Cancer Australia website, look up Australian Brain Cancer Mission. But that's not really what I came to talk about. It's really around these resources, which are really fabulous to be here to launch today. We all know, particularly people in this room, the considerable burden that brain cancer, brain tumours place not only on those diagnosed but also on the families and carers of those people, but also on the community more broadly. This year it's estimated that there'll be almost 2,000 new diagnoses of brain cancer in Australia, and the young are disproportionately affected by brain cancer because it's the leading cause of cancer-related death in those under 25 years of age. Unfortunately, as we all know, the road ahead for those people is very challenging, as well as for those around them that are providing care and support. There are significant tumour and treatment-related effects, and we've heard about that today, which impact on cognitive and physical functioning. And in addition to that, there's also the emotional overlay, the fear of recurrence, and the huge toll of having a poor prognosis cancer where survival rates are low and have remained relatively unchanged over time. And that's a very harsh reality to face. So as a clinician, I have seen the impact of brain cancer, but I've also experienced the impact of this disease on a personal level. I've seen a very talented and vibrant colleague with a young family tragically lose his life to brain cancer. And just last month, a very close friend of mine lost her 26-year-old son. 6 years ago, I lost my mother to GBM. And that 15-month journey was difficult for her, but also for all of us who loved and cared for her. She was a very vibrant, physically and mentally highly active woman. And there was so much to navigate and coordinate in accessing treatment across systems and with a number of different clinicians. There's also the emotional toll when the disease progressed. This was further compounded by the fact that English was not my mother's first language. And for all these reasons, I'm especially pleased to participate in the launch of these information resources in different languages to help and support people affected by brain cancer and their carers. I'd like to particularly congratulate the Brain Tumour Alliance of Australia for bringing together the consortium and also obviously to congratulate the partners who came together with Brain Tumour Alliance of Australia for the production of these invaluable resources to inform and support Australia's multicultural population. At the time of diagnosis, when your world suddenly seems so out of control, having quality, accessible information in your language to support your understanding of the disease and to help you interact more effectively with your treatment team is so empowering. I had the opportunity to look at these resources before today, and It's Okay to Ask booklet just does that. It empowers the person to ask the questions and that it is okay to ask those questions. The other resource, the My Brain Tumour Pathway, helps patients and their carers to map where they're at in the journey and what happens next. Again, this is so important. Knowing that there's a plan, knowing who to call for help, really provides a sense of control and comfort in what can otherwise feel like a very uncoordinated experience. And then the video of patient stories is such an important resource, I think, for newly diagnosed patients with high-grade glioma. It's a very traumatic and confronting time. Being able to connect and hear from someone who has trodden that path in their own language is a powerful way not only of providing information and support, but also hope. So Cancer Australia is really pleased to have supported the development of these resources that are now available in 10 languages, as you've heard, through our Supporting People with Cancer grant initiative. The aim of this initiative is to reduce the burden of cancer through the provision of grants in areas of identified need. And to date, Cancer Australia has awarded 110 of these grants at over $8.8 million. These grants, these grants also aim to encourage effective partnerships between organisations to improve outcomes for Australians affected by cancer. The partnership approach is critical to improving outcomes, and it certainly was embraced in the development of these resources, reflecting involvement of consumers, health professionals and community organisations working together. So congratulations to all the partners who worked so passionately and collaboratively. The Brain Tumour Alliance Australia, the University of Queensland, Queensland University of Technology, the Olivia Newton-John Cancer and Wellness Centre, Austin Health in Melbourne, the New South Wales Neuro-Oncology Group, Grey Matters, the International Brain Tumour Alliance, the Sydney Brain Tumour Support Group, Polaron Melbourne, Nemix Melbourne, Sigwinetti Media, Bartercard Canberra, Judith Micklejohn, the Chinese Cancer Society of Victoria, and most importantly, brain tumour patients and carers. In particular, I'd like to acknowledge the very integral and unique contribution that the involvement of consumers, people affected by the disease, can make towards improving both the experience and outcomes for others. So thank you for the courage and the generosity of consumers who participated in developing these resources. This strong and meaningful engagement and the powerful insights that you shared will assist in ensuring that the resources meet the needs of people affected by brain cancer. Once again, I'm delighted to participate in this launch today. Thank you.
Thanks very much, Helen, not only in your role as the CEO of Cancer Australia, but also for sharing those personal insights, and your, I think that was very kind and much appreciated by all. Next, I'd like to ask Marina Castellan to come to the stage. She's a care coordinator who I work with at Royal North Shore, and she's often the one who fields a lot of the inquiries about the brain tumour journey, and she should. I'd like to hear her comments on these new resources.
So these resources, I'm really happy about these resources because we don't have a lot of resources that are specific to primary brain tumours. So it's really something that's been coming for a while, and I really congratulate BTAA and all the collaborators that worked on this. In the past, what I've done when I've met people is write things down for them and handed them bits of paper, so to actually have something that looks this great for them to take away and actually process down the track is a good thing. I think when people are diagnosed, the information's overwhelming, it's confusing, the pathway's confusing. So to have something to take away that you can, you know, nut out down the track and come back and actually write your questions down is a really valuable thing. What I've tended to do in the past as well is actually try and Google translate some of the information for patients. So to have you know, these resources in other languages is a fantastic thing as well. And the only other thing I wanted to say, you know, that I find a lot in the work that I do is, you know, where you get people that you'll meet them down the track and you'll ask them what type of tumour they have, and they actually won't know. So to have it written down, you know, that they can present it to another medical person, because, you know, the team is vast sometimes and you are going between different doctors, so that I think is a great asset for the group of patients we see.
Thank you, Marina. So I think that just leaves us with Catherine. Catherine's the chair of BTAA, and I can probably just plug that in for you. Issues here. Do you have a...
No. What I was going to do, 2 days ago we launched our new website, and I was going to show you how easy it is for patients.
We can do it on mic.
Oh, okay, yeah. Perfect.
Just clear my browsing history.
Just while we're doing this, I would like to, as everyone's been mentioned who was involved, but one person in particular has led this project for the last 3 years, and it's my colleague Trish Berman. And if it hadn't have been for her, this wouldn't have happened. She's managed to get everyone involved and has driven it, has negotiated with Cancer Australia as things changed, and a huge, huge thank you.
Yeah, I'd agree. No, it's all. There you go.
So this is our new website.
Sorry. There you go. You have to look up.
Oh, there, okay. The company that's developed this for us said, "Oh no, it's going to take a couple of months." And Trish said, "We've got to have it for today." So they've worked very, very hard. On the front page, there's this a caption there, and it'll always have the latest news. At the moment, it's got our new resources, and it's purely a matter of... Where have I gone? Sorry. And it clicks onto that page. And there, it's so easy to see. I'll click into one of them if I... You might be... Oh. It's like operating, isn't it?
Harder.
Yeah, I'd love you to. Just do it up to Chinese or something, just on one of the languages.
All right, so you got the videos.
Yeah. The videos only went on this morning, I think it was.
And then the pathways.
And they're able to be printed off. So the doctors, we're not producing printed copies because, Jonathan might only have one person a year. So, but if he has someone come into his room, he can print these things off and tell the patient about them. And our challenge now is to make sure everyone around Australia, all the clinicians, know about the resources so they can use them. And that was literally all I wanted to say, just to see where they were and let you have a visual look at them. But thank you all for...
That's fine. Well, thanks, Catherine, and thanks everyone once again, you know, I'd echo Catherine's comments about Tricia and her role in this, because she certainly was the one who brought it all together, and I'm sure she's both excited and relieved about this happening today. That concludes the morning session. We'll be back at 1:15 after lunch. Any questions for any of the speakers? You know, lunchtime's always a good time to ask, and we'll see you again shortly.